See, my midline is my landmark. I will go up until I not see anything else. Okay, now my depth. I need the lever to fill everything. And you just see, always like that. And my gain, I need it a little brighter. Okay, I have here, take a deep breath and hold it. This is the first picture. Breathe normal. My first picture was the aorta. I see the aorta. I don't care that much to open the aorta all the way to make it clear aorta. I'm not scanning aorta. I'm scanning liver, and I see the tip. I see it horizontal. I see it most of the screen is the liver, and I don't see shadow. I see all the texture of the liver. So this my first picture, left liver loop. Again, deep breath. This my first picture. My second picture with the quadrant loop, which is here. Breathe normal. Same thing. I see the tip. It's horizontal. I see the ligamentum venosus. I see the quadrant loop. I don't have shadow in my picture. Okay. Third picture. Take a deep breath. With IVC is like that. Breathe normal. Okay. So the same thing. I see the tip. It's horizontal. I see the entire liver without shadow. I see the IVC here. I don't care if the IVC part of it closed or not seen very well, but what I care about is what I see my entire liver very clear. Do you feel my hand? Did you feel my hand? Okay. Did I move my hand?
No.
Did I move my transducer?
No.
Okay. All these three pictures from the same spot. Forget about the screen now. I'm talking about aorta, quadrant loop, IVC. Aorta, quadrant loop, IVC. And I barely move my transducer. Aorta, quadrant loop, IVC. Now take a deep breath and hold it, and you're gonna tell it. Aorta, quadrant loop, IVC. Quadrant loop, aorta. Quadrant loop, IVC. Quadrant loop, aorta. Quadrant loop, IVC. Gallbladder. Okay? So from the same spot, aorta, quadrant loop, IVC, gallbladder. This is my hand. Okay, for my gallbladder, yes, I can see the gallbladder, I can see the portal vein. I'm sorry, you are, but I am cutting all this liver, so I need to adjust my depth, and I have to show it like that. Breathe normal.
So you don't really have to have the gallbladder open in that sense.
I don't care about the gallbladder. It's just a landmark to tell me I am moving from segment to segment.
Okay.
That is the main reason we have picture with the IVC, picture with the gallbladder. Is not like a selfie with another friend. No, we are just trying to divide the liver to segments. So this segment, my landmark is the gallbladder with the portal vein and the fissure between them. So, but my main reason is my main thing is to show the entire liver with the diaphragm here in the bottom, so I'm not cutting it like that. Okay, because some of you can give me the picture like that. Yes, it's a gallbladder and the portal vein, but what I'm scanning now, I supposedly I'm scanning right liver. So I'm not scanning now right liver, and now I'm scanning the portal vein and the so okay, you got this one. So again, take a deep breath now. First picture, aorta, quadrant loop, IVC, gallbladder, and the fissure. Where it went. Okay. Breathe normal. One more time. Here we go. That's your third picture. Okay. Breathe normal now. How many picture I got?
That was your fourth picture?
Fourth picture. Okay. Number 6 picture is the dome. I can get the dome from the same spot. Big deep breath now. Dome. All the way here. Breathe normal. You see the screen or no?
Kinda.
Okay. Okay. So the dome is here. Did I move my transducer? I am in the same spot and I got 5 picture out of 6. Look at my hand. This is aorta, quadrate loop, IVC, quadrate loop, aorta, quadrate loop, IVC, gallbladder, dome. I barely move. I didn't move from the midline. One more remaining, which is with the kidney and the measurement. I will move my hand to her side. Okay. And I keep telling people the kidney in your side is like that. You put your hand like that. This is the direction of kidney. So I know her kidney is gonna be like this direction. So I will move my transducer to be in this direction, which is the kidney, and unfreeze now. Take a deep breath and hold it. And I got my shot. Sorry, breathe normal. You don't have more ketchup. Deep breath and hold it. And this is my other picture. I don't care that much about the kidney. All what I care about is my liver. That's it.
And then measure from the tip down to the bottom.
My measurement gonna be here, tip, all the way to the end here.
Okay.
Okay. So, where is my orientation? Is like that. Like what I told you, the people kidney is like this direction. So that is my direction, and I find my kidney. I'm done with the surgical plan.
Okay.
I don't move my transducer from here. Aorta, quadrate loop, IVC, gallbladder and fissure, dome, kidney and the measurement.
Okay.
Okay, transverse. Transverse first, I know her left liver gonna end somewhere here. So my transducer gonna aim, I will go transverse to go all the way up until I cannot go anymore. And I will ask her, take a deep breath and hold it. Breathe normal. Ligamentum venosum. I see the tip. I see it kind of horizontal in her body. And I see this shape. I call it S shape.
Okay.
This your first picture. Your landmark is ligamentum venosum. And the landmark, the orientation, you go up, you ask her to take a deep breath, I aimed up. The second picture is the same spot, I will go more higher, take a deep breath and hold it, and I will aim down. I will go more higher and I will aim my transducer down and I see ligamentum tears. Adjust my depth because I am scanning. I don't care about ligamentum tears, I just need it as a landmark. Is normal. So I have the tip, I have the left loop, very clear. If she has any pathology, I can see it, and ligamentum teres as a landmark in the picture.
Okay.
This is a 2 picture for the left loop. One, I go up and I angle down for ligamentum teres, which is like a genetic star here on the side. And by the way, I see the pancreas here. How see my orientation is I am tilting a little bit. I'm not straight transverse. Then you can see the pancreas head is like rounded.
Okay.
Now, take a deep breath. I will move to right for the bunny ears. The only thing, your picture was like that. I need it like that. The bunny ear to be in the side.
Okay.
I don't need to cut this area. Breathe normal. By the way, I don't care that much if I can
If
see
they're not
all the
open.
bunny ear.
Okay.
I'm scanning liver. Okay, so
So you don't want it like that.
the only thing you see the difference between yours and mine, I moved my IVC to the end of the picture,
Mm-hmm.
to the right, then I show more liver. You cutting part of the liver. Good?
Mm-hmm.
Okay, after that, what you have in the protocol after this one? The gallbladder?
Yeah.
Well, I think the porta habitus.
Porta
yeah.
habits. Okay, porta habits. I will go like where I was here to see the kidney. Take a deep breath and hold it, and I will see the portal vein coming up here. I put color. That's the porta habits.
Mm.
In the middle and the top.
This one,
Okay.
this red one, when the portal vein entering the liver.
Mm.
Okay, breathe normal. So this is the porta habits.
Okay.
Okay, this is very clear and towards the transducer, and it's red. That means it's going towards the liver, which is hepatovagal flow.
So that's incorrect then, because that's what we were taught.
This is okay if you just scanning the portal vein,
Okay.
right and left portal vein. But for porta habitus, that's where we're gonna get it. Because the one you showing me, I cannot differentiate between the main portal vein and right and left, so could be the flow is very varies in direction. Why I need this one and all of this is like all the protocol in the hospital is like that, because this is very clear to rule out portal hypertension. Okay, so if the flow toward the liver, which is here towards the transducer, which is red, that's mean hepatopetal flow. This is very important. If this one getting you blue, and it's forbidden to invert this color. If that blue, that mean maybe the patient has cirrhosis and she has like resistant liver and sending the flow backward, which is hepatopugal flow. So how I gonna rule it if the portal vein transfers? It's really tricky. But this one is very clear, either up or down.
And that's where you would take the pulse wave too.
Yeah.
Could you show that?
Okay. Again, deep breath and hold it. Breathe normal. Do you see how the portal vein flow supposed to be?
Mm-hmm.
Kind of very straight, just a little bit wavy, like we call it phasic flow, and it shouldn't be pulsatile. If it's a pulsatile, that's mean early stage of cirrhosis.
Okay.
Okay, I don't want to see it up and down. Okay.
And the waves on the top always.
That's mean because we are towards the transducer.
Okay.
What's your hepatometer? If you invert it, you missing with that.
Yeah.
Like if I see it down here, that's mean hepatofugal flow.
Right. Okay.
See, I got in trouble for that one. She told me that it was supposed to be on the bottom line and it had to be blue.
Okay, no, she is right if she's getting it from here, but that is not the common protocol in the hospitals. Okay, let me tell you what she is trying to tell you, and she is right technically. Okay, and it should be blue, like what she said. This is in the pancreas area. This is the portal vein again. I can do it here. This is the portal vein and this porta hepatis as well. If I put this here, it should be blue. And if I double it, it will be blue.
Because
the
that's it
business.
exiting, right?
It's entering as well.
Oh.
It's the same thing, but we are not. That is not that what she telling you. This is the correct answer. Okay. So the only thing is, like, I see some tech, very few tech in the world doing it this way, but I rather know. Like even the radiologist call them like, why you do it? For me as ultrasound tech, I totally understand that's coming from the portal conference and entering the liver and away from transducer, but it's entering the liver and it blue, so everything is right and should be blue the baseline. But that is not the common thing. Like the same thing, like you remember I told you from the first lecture, red and blue is nothing. It's just direction of flow. So if you show me carotid artery blue and the blue was in the top of the baseline, the top of the color map, that's right. But that is not what our eyes used to see it. There is like protocol between all of us to make the artery red. Okay, the same thing. Most of us, all the people doing the portal vein from here when it's entering the liver from the bottom, and then it will be very clear to see it like this direction.
Oh, I see that.
And should be red. Okay?
Okay.
Okay. The kidney one.
I think gallbladder's next.
The gallbladder, okay.
Yeah.
Gallbladder and transverse, for me personally, I will go between reps. Because I will see it like that. This is the gallbladder transverse if you are scanning transverse liver. If you're trying to get hepatic duct and this stuff, you will turn your transducer like that. Okay? But still, I'm scanning liver, so I care more about the liver. Okay, the kidney one, breathe normal. Okay, when you're ready, take a big deep breath. I will go up here and I will go down. In Itzel here, it's like, yeah, I know why you're struggling now. Her kidney like more medial.
Mm-hmm.
That happens when you have small patient size. This should be the kidney picture. But let me go.
Oh, for the transverse.
Yeah, this is the
Okay.
kidney transverse. You're gonna show this normal. Alhamdulillah. I need to see the kidney circle.
Okay.
So the kidney in sagittal was this orientation. You agree?
Mm-hmm.
I will go transverse on it. Sagittal, transverse.
And are you right underneath the ribs? Or are you like
Yes.
on it? Okay.
This one is not standard from patient to patient. Like you remember when I showed you last week the kidney, you can get the kidney from here all the way to the back.
Yeah.
Like some cases, if I struggle getting it from this axis, I will turn the patient on her side.
Okay.
Maybe I'm gonna get better
So
image.
you don't see any renal sinuses or anything in the.
You don't have to. All what you need to compare again the cortex, renal cortex with the liver parenchyma, and you need to see the space between them, because this area can collect a lot of fluid for many different diseases. This what you can. What you care in this picture is the lateral border of the liver,
Okay.
and this is space between the liver and the kidney.
Okay.
The dome from the same area, take a big deep breath now and hold it. You go all the way up here. This is the dome again.
And you want like all those vessels and stuff closed.
Yes, so it's again like a potato.
Okay.
That's it.
Okay.
Pancreas, you don't need to ask your patient to take a deep breath, just go all the way up and tilt your transducer, curve it, tilt it this way and angle down. And here you see the
Okay.
pancreas. Your problem was like that. You are very transverse in here. You need to tilt it
So you're like oblique a little bit.
oblique a little bit. Yeah.
Okay.
Okay. Then you can see the circle. You can see the GDA, CBD, and you can see the border of the
Okay.
pancreas.
So is this like not okay then?
This is okay.
That one's good.
That's
Okay.
good. So